1986, the first Israeli medical mission visited South Africa to promote Aliya. Today, 2 years later, the South African doctors, dentists and pharmacists, who have since made Aliya with their families, gathered together at the invitation of the South African Zionist Federation, the Ministries of Absorption and Health, and the Aliya Department of the World Zionist Organization. The special interest in South African Olim was emphasized by the presence of Minister of Absorption Yaakov Tzur and Minister of Health Shoshana Arbeli Almasino.
And in fact, it was the pilot tour, but also very important that meeting where the guys came to the medical delegation came to Africa. And I met the guys, and that was a very strong motivating point to start things off.
The experience of absorption in Israel, only the Olim can tell us.
Having started work in the cardiology department of Hadassah in Karim, it's a very different experience to do anything in Israel, especially medicine. And having experienced the multi-faceted side of Israel on a personal level and on a professional level has added to my integration and appreciation of the country.
I've been working now for just 1 month, doing half gynecology, half genetics. The work is interesting. It's interesting to see the different approach to obstetrics. South Africa we followed more the British School of Medicine, and over here it's combined European and American, and it's quite a change for me.
There was a network of South Africans who we got hold of, South African dentists established, and I've been here more than 5-6 years. And through them, I found my job. I decided more or less what area I wanted to live in. For me, it was either to live in Jerusalem or live in Tel Aviv, or migrate to Tel Aviv. And as it happened, North Tel Aviv is where we ended up. We both ended up there, and that's where we both started off.
I decided to come to Israel some years ago when I was asked to set up a course under the auspices of Bar Ilan University to train medical doctors in homeopathy. And there were many ups and downs, and I eventually came last year in November to start the academic year. I went into private practice cold turkey. I just said, this is it, I'm beginning practice, and I did. I began in a room that was donated to me by the man who sponsored me here, and with no patients, no advertising, and I just began. And so I've built up. I now have 2 places. I'm here in Ramat Gan and also in Tel Aviv.
Okay, socially Hilton and I have actually become very involved, and we started a young Olim support group in Israel, which has become very active and very successful. What it does is that we try and provide support both in the social sphere and integration into the country, and it's become very, very successful. For example, this week alone we organized a pub evening, and on Saturday we've organized to go abseiling near Petach Tikva. Social lives here, I think, is outstanding. I think that's the single best part of living in Israel for a young person, is the social life here.
Well, the question that the young doctor who's about to qualify always has to ask is, when should he come? In principle, the lower down on the pyramid you come, the better, for the simple reason that the lower down on the medical pyramid that you are, the more jobs there are, the easier it is to integrate into a job at that level. And the better positioned you are for getting a permanent job in the future. So for career reasons, it makes a lot of sense to come into the Israeli medical system low down, either as an intern or just after being an intern. Yeah. Well, in retrospect, what has emerged is that the basis for the fact that I have a job now has been that in 1985 I came here on an elective program as a student, and I worked in the Department of Cardiology. The contacts that I made then as a student served me in very good stead and resulted in me getting a part-time job in cardiology, which then helped me make a decision as to my future career and opened up doors for me to a specialization program in internal medicine, which I'm going to be starting soon.
I came from a private pharmacy environment in South Africa. I owned my own pharmacy for about 14 years. And now I've come to work in an institutional pharmaceutical environment in a hospital. How do I feel about it? I find it very exciting and very challenging. And by coming into this institutional environment, I find I've gone onto a steep learning curve. I'm having to learn some new things about new drugs. I'm having to resuscitate some old techniques that I haven't used for years. And I find it very challenging, interesting, and satisfying. We came here as a couple, and we wanted to get into a situation where we would feel comfortable with our own things around us.
We've been very lucky because we arrived here and we were plunged straight into what I call Israeli society. Our friends are Israelis. As sympathetic as they are to helping me learn Hebrew, they're also very interested in learning to speak English. I'm able to handle situations like shopping, situations in the street, situations with people. The basic Hebrew now that I'm using came from the Ulpan, but I realized that if I would like to go further in order to participate more in Israel, I have to learn more of the language myself.
Initially, I anticipated that would be a problem to work in Hebrew, but it turned out that it wasn't. I had some Hebrew from South Africa, and one can get by with English, and eventually one just picks up the language from being here. And now it's no problem. זה בגלל הדלקת שמה, זה מלא נוזל גם כן, הוצאנו את זה בבוקר, ועכשיו זה צריך להיות פחות גדול, נעשה עוד פעם צילום חזה ונראה, והמצב הולך ומשתפר בעצם.
Well, my background in Hebrew was nil. Okay, I went to a public school, and I did an elective in Israel where I learned a bit of street Hebrew. But it took me about 5 minutes to realize here that two things. Firstly, you don't need Hebrew. In other words, it's very good and very important. And now, 4 years down the line, I'm fluent in Hebrew. It's wonderful. But on my first day when I couldn't speak Hebrew and I started working about 5 weeks after I arrived, on that first day, I didn't need Hebrew, firstly. Secondly, where I come from, a person who can't speak English is regarded by his peers as an inferior citizen. Here in Israel, a person who can't speak Hebrew is accepted as somebody who's new, but is given the same status as anyone who speaks fluent Hebrew. And Dafka found that I speak English is in some circles a plus.
Well, about Hebrew, it's been my biggest stumbling block. I was 2 months in an Ulpan and I dropped out, a complete failure. I couldn't learn from the system at all. I found it boring, and so I gave up and started to practice, and that's really when I began to live in Israel. I have virtually no English-speaking patients or Anglo-Saxon patients. I think I have 5 or 6 on the practice, and I'm dealing all the time with Israelis, and I have a constant language problem, but I still have a very big and busy practice. I get over some of the problems by bringing the doctors from the course to act as translators, and that helps. And I'm actually learning much more Hebrew this way than when I was at the Ulpan. Just from listening to the patients, although I don't speak, I actually understand quite a lot now.
I couldn't imagine going in South Africa to a dentist that only spoke Russian. They couldn't speak to me in my home language. It just wouldn't happen. We've been here 2 years, and our Hebrew isn't exactly what it should be. I'd love to be able to speak Hebrew fluently, but I as yet can't. I found that I cope very, very well. My Hebrew as far as dentistry goes is as good as it's going to get. You use the same words every single day. A lot of my patients, I'd say at least 60% of my patients at both Herzliya where I work and the Kfar Saba practice are Anglo-Saxon patients, and if they're not, well, they try and impress me with the English they learn, which is fine, I don't mind. You know, it's a lot easier for us.
Coming to Israel means, first of all, having to come to terms with a new language, and that's a process that takes time. You also have to come to terms with a new culture, and you have to learn new ways of coping. You have to develop coping strategies.
My first year was difficult, and I assume that for every new Aliya it is a difficult year. It is definitely a period of adjustment, a period of getting used to how the country is run, a period of getting used to handling bureaucracy. But once you overcome these hurdles, there is a tremendous amount on offer. For myself personally, I'm extremely interested in music, and Jerusalem has given me more than I should ever hope to attain anywhere else. I've had the most wonderful year and a half musically, culturally. I am very, very busy and very, very happy.
The choice was between closing the clinic to the Kupat Cholim patients or generating a system whereby even the Kupat Cholim patients at very limited cost could avail themselves of private medical services, which means round-the-clock service from your own personal GP. If you need to be seen today, you will be seen today. Ongoing care. When your doctor goes to the army, to Miluim, overseas on holiday, you're not referred to some bureaucratic organization called a kupa to find some doctor who you've never heard of who's going to take over your care. You have a doctor as part of the team who has your record that takes over the care from you while you're away, and when your doctor comes back, it's all there in your record. So continuity of care, prenatal care, well baby care, which are not offered as services under Kupat Cholim. They're provided in the fragmented system as it is by the state. Private doctors in this country do well because they charge a lot of money for their visits. The fee schedules are very, very closely allied to what doctors would charge in the States. It worked. Our patients love the service that we provide. They're happy with the new innovations that keep getting added to this clinic. They're happy to be served by doctors who are earning well, who are happy, who find their work rewarding, and that's true. I love my job. I work hard. I earn well, and it's reflected in the care that I'm enthusiastically giving to my patients. Let's deal with that. Let's deal with the earnings. Without going into figures, my gross earnings, what I earn before I pay tax and before I pay VAT, GST, and before I pay national insurance and before I pay expenses to this clinic, the gross earnings are astronomical. The status of the economy of this country being what it is, only a small proportion of that comes home. But the truth is that if we just examine the take-home pay, it's probably well in excess of what I would have been earning as a successful GP back in Johannesburg. That is largely due to the fact that medical fees in this country are astronomically higher than fees back in South Africa. Just as an example, if you want to figure a first visit with a GP, a first consultation with a GP costs 60 shekels, which is the equivalent of about 85 rand.
Regarding preparing for Aliya, it's very difficult because however much one tries to prepare, when you come here, you're still going to say, well, I should have done this and I should have done that. Regarding the medical side of things, I think it's important to start contact with the Ministry of Health, the Scientific Council, to arrange for recognition for one's degree and training. It's important to have all the documents duplicated and certified so that it's all available.
About 6 months before we made Aliya, I came here on a pilot tour. There were four or five other pharmacists in that group, and together as a group we explored the possibilities for employment.
If I'm going to say anything about coming on Aliya, I think the first thing is to put aside all your preconceptions. It just doesn't work the way you think it's going to work. It doesn't look the way you think it's going to look, and it doesn't feel the way you think it's going to feel. I think the single most important thing to make a good Aliya is to have a good family background or backing. If you don't have this, it's very difficult. And to come with a very open mind. It just isn't the way you imagine it's going to be.
We know that a lot of people come in Aliya because they have children here and other members of the family. We came here because we actually want to live here. This is where we actually want to stay. Our children might leave, they might go to other parts of the world. We're at a very good period of time in our lives because we don't have young children. Therefore, Israel is a challenge and a new way of life for us, and that is the reason why we're here. I suppose we could have chosen other countries, but I think Israel was one of the best ones. We didn't know, we really didn't know that Israel was going to turn out, and we did have doubts. I myself had doubts in the first year, but now that the hurdle of the first year is over, we're into the second half of the second year, and we decided that this is going to be our home. It's much easier.
A lot of doctors passing through Israel on pilot tours and on, let's see, the country tours come through this clinic for various reasons. And they ask us questions, and one of the standard ones are, if I were to go home and specialize in preparation for Israel, what should I do? And my answer has always been, go back and do something that you enjoy. Go back and do something that you're good at. If you're good at it, you'll do well here in Israel. If you're a good specialist in any field, you'll succeed here in Israel. I found that it's a free market medicine here in this country, and the guys that are good, even in the so-called oversubscribed fields, walk into a market that is saturated and clean it up.
Basically, I think my history could more or less sum up what my Zionist feelings were. I came to Israel for a few months on the way to Australia. After I'd been here a few months, I knew enough about the country to decide that for me to go anywhere else would be crazy. It's difficult for me to turn around to anyone else and say this is the place for you, but for me, there's no other place. I know now that there's no other place that I could live. I go through days when I think I've got to be crazy to be here, but most of the time, at the end of the day, when you look back at it, there's things in this country that you couldn't repeat anywhere else.